So I'm going to show you real quick how to take care of your braces, how to brush around them, floss, what foods to eat, wax, how to take care of everything that comes in your little kit that you're going to take home with you today. So the way that you're going to want to brush with your braces, you're going to want to use the toothbrush that we give you, and you're going to go in big circles around your braces. You're going to angle down towards the brackets and up towards your gum lines. You want to make sure that those bristles go under the wires and you get each little nook and cranny of those brackets. You want to do the same thing on the bottom. Right there on your gums, big circles around everything really well, and the insides of your teeth too. You're going to be brushing for 2 minutes twice a day or every time you eat. So we will give you a timer to take home. You want to flip over that timer and brush until the whole timer is done. So that's a whole 2 minutes after breakfast, after lunch, and after dinner. If you have snacks too, it's good to brush after them as well. At school, it is a little bit difficult, so even if you can swish with water really well, that helps get some of the food out of your teeth. But if you can brush with a toothbrush and toothpaste, that's even better. If not, just brush when you get home from school. But that's why it's really important to get that good 2 minutes in the morning and then after you eat dinner as well. Wax you're gonna get too, in case you have anything sticking or poking you, like a pokey wire, maybe a bracket comes off. You will take a little piece of wax from your box and you take off a nice big, like a pea-sized amount, and you can soften it, roll it into a ball with your fingers, and then you just mold it around anything that might be poking you. So say that bracket right there, maybe it's rubbing you raw on your lip or something. You just kind of mold it around there, and it'll help keep it nice and smooth so that nothing's bothering you. Of course, you can call us and we'll talk you through anything. If you have something poking you, we can have you guys come in to clip a pokey wire or anything like that. Flossing is going to be different. So if you try and floss like normal, which will be super, super important, especially with braces, you'll see that you can't get down to your gum line when that wire is in the way. So you're just going to use this special floss threader. It almost looks like a needle and thread. It totally looks like a needle and thread. You're just going to tie it to it, and then you will go underneath the wire, pull it through, and all that's really helping you do is just get it right underneath the wire so that you can get that floss down to your gum line, go back and forth just like you normally would with floss, pull it all the way through. Of course, you'll use a shorter piece of floss, and then go to the very next tooth. So it is time consuming. You'll go around each little tooth. It's not very hard, it just is time consuming. I always like to say when I was younger, I got a little vanity mirror, like a makeup mirror that's magnified, and I think that's really helpful for kiddos or adults, anybody to sit down in front of. You can see a lot easier, you can get it around each little bracket, around every wire. I think it's super helpful just to be able to sit down and do that. I also say if you do the top one night and the bottom the next night, that's okay too. We just want to be realistic with our goals and what we'll get done, so that we're not taking on too much at once, but definitely if you do the top and bottom every night, it makes us so happy. We will give you, let's see, switch to the top. This little brush is really helpful. So it comes with a little lid, just like that, but it doubles as a handle. And what that helps you do is just get around your little wires. Of course, this one's a little bent up because we use him a lot, but it just helps you kind of clean around everything really good. If you have food stuck in there, anything like that, that really helps. There's one other kind to floss. So it's this little flosser stick, and it has a really skinny tip on it, which you're just going to go under the wire, just like that. So this is super helpful if you're kind of in a pickle or you want to take them with you somewhere. The only thing is you can't go back and forth with these. So where's my phone? You can't get that back and forth threading motion, but you can go up and down, and they're super helpful for times when you can't get that whole floss. You can just do that, okay? We will give you this little pamphlet to take home. It goes over brushing and flossing. how to do everything, how to floss, brush. It shows you all your angles. Then I always like to tell patients too that you want your gums to look this nice healthy pink color at all times. If they ever turn red or puffy, really the only thing that means is that they're just not being brushed enough. So you want to take that toothbrush and massage those gum tissues a little bit better, floss that area a little bit more often, and your gums should kind of go back to that nice healthy pink color. On the back we have 2 pictures. So we have nice healthy clean teeth when they got their braces off, and then somebody that might not have brushed super well. They have a little bit of those stains on their teeth. It's called decalcification. I have another picture here. You can see those bright white stains. So that's from the plaque sitting on the teeth too long. So anytime you have those little white fuzzies on your teeth that kind of can go around your brackets and sit in those areas that are kind of tricky to get to, that's why you want to spend lots of time with your toothbrush brushing those areas right down there super well. And same on the top. You want to get right on those gum lines, because some people are more susceptible than others for those stains, but we really don't know who is until it's too late. Those are permanent. You can't bleach them out or whiten them out. They're there forever. Most of your teeth that you have are probably permanent. We only get 1 set of them. So if we get any of those stains, it kind of breaks our hearts, but they're easy to not let them happen just by brushing those little areas really well. So now we'll switch over to what to eat with braces and what not to eat with braces. Each one of your little brackets is stuck to your tooth with orthodontic glue. So that can break off. It's not like super glue or something, but it can break off from eating something too hard, too sticky, maybe picking at them. So you never want to pick at your braces with your fingers. You never want to have your fingers in your mouth. You never want to bite on a water bottle or open anything with your teeth. One of my assistants, Kim, she's amazing. She always says teeth are jewels, not tools. And that's like my favorite thing that I've ever gotten from her. Teeth are jewels, not tools. So never use them to open anything, because it can hurt your teeth, but it can also break brackets. So they can come off from eating things. Every broken bracket adds about a month to your treatment time, just because it can slowly start to build up and add extra treatment time, because we have to put that bracket back on. Sometimes that tooth will move back to where it started. So you want to avoid those hard foods. It's not as bad as it may sound in the beginning, but any kind of vegetables, you're going to want to cook them. No hard chips, crackers, or cookies. If you're going to have chips, just keep it to potato chips are okay. No kettle chips or tortilla chips though. If they're just thin, crispy ones, that's okay. No popcorn, no hard candies, no nuts of any kind. Peanut butter is okay as long as it's creamy. Like I said, cook all your vegetables. Most fruit is okay. Apples, really thin slices, very thin. Coke, soda, smoothies, they're okay. Just anything with sugar in it, you're going to want to brush and rinse with a mouthwash afterwards. Candy, keep it to like a Reese's peanut butter cup or a plain Hershey's Kiss, something that'll just kind of melt in your mouth and not too sticky, nothing hard. No Snickers or anything like that. Chicken legs, chicken wings, any kind of meat on the bone, you just want to take it off first and eat it that way. So you never want to bite right into anything like corn on the cob. That could break a bracket as well. Breakfast foods, pancakes, waffles, eggs, soft bacon, that's all okay. Cereal, let it sit in your milk for a little bit longer and kind of soften up. Pasta is great. Sandwiches are fine. Burgers and fries. You just want to cut stuff up into smaller pieces. Keep stuff smaller. Take it off with your hands rather than biting right into it like that. You just want to take it off with your hands first, and that'll make it easier to eat. You'll learn really quick what is easier to eat, what's harder to eat, how much you're going to want to get out of your braces, and you'll learn how to take care of stuff really quick. Kind of how to get food out of your teeth. Swishing with water is really great. Of course, a good mouth rinse is really good too. Stay nice and hydrated. Another thing I've noticed since I got my braces is I get really dry really easily. So keep some water with you. It's super good. It's just going to get the food off your teeth and stay nice and hydrated, and it just helps everything really well. So Let us know if you have any questions. We're always here. You can text us. Nothing is a stupid question or a silly question at all. We've heard it all. We love answering your questions. So just let us know.